Hi, I'm Nick Nanatovich. I originally grew up in Florida and was born and raised in that area, and came up to the Midwest and did my schooling for medical school at the Chicago Medical School. I finished my training at the University of Chicago Hospitals for Orthopedics, and then continued my postgraduate training at the Upstate Medical University in Syracuse, New York for spinal surgery. Most of what we do does not really involve surgery. About 95 to 98% of our patients don't need surgery. And I think that's one of the best pieces of news we can give the patient when we see them in the office with the type of problem they have, is to tell them you don't need surgery. Well, you'd really like to see that sigh of relief on their face. I've been in practice approximately 6 years. The first half was in Fort Wayne, and then moved to Northwest Indiana to come join Lakeshore Bone and Joint Institute. The reason I chose to go into medicine is I really like the interaction with people and being able to help them. I originally started my training in aerospace engineering. It just lacked that interaction with people and that ability to help people in a direct way. Orthopedic surgery really came to light in my mind when I injured my knee and had to have surgery for it, and so that really piqued my interest regarding orthopedic surgery in particular. But as far as being a physician in general, I just really like to be able to work with people, get to know them, and see what I can do in order to be able to help them. And I think being a physician is one of the best ways to do that. The conditions that I specialize in typically involve the neck, the middle, and the lower back. Usually has to do with a degenerative condition, which means just the type of wear and tear that we all deal with on a daily basis and with age. As time goes on, the area of discs, which is the cushion between the two vertebral bodies, can cause some crowding of the nerves and start causing some pain, even neurologic symptoms as far as numbness, tingling, or weakness. Those are the types of things I typically treat patients for in order to get them through those conditions and help them feel better and alleviate them. Patients should come to see me because I think that specialized medicine has really gotten to the point where there's not enough time to spend time with patients because of the demand for your services and the demand for the type of training that you have. I actually like to take time with my patients, get to know them a little bit. I really think that helps me to get a better understanding of what their problems are, but it also helps you to get a diagnosis a lot of times as well. What we're taught in medical school is that about 80% of your diagnosis comes from that patient's history and telling you what types of problems they have, when they have them, and the characteristics of them. So that's one of the reasons I think that patients should come to see me, because I'll take time to listen to them and give them the time that they need to let me help them. When patients should come see me is when they've had problems with their neck or back that have lasted more than a few weeks. Most problems that are not very severe or not very serious usually go away within that time frame. If they're lasting more than 2 to 4 weeks, usually there's something more serious going on with regarding the spine, whether it's involved with a disc or some pinching of a nerve that's not alleviating or not resolving with time and just activity restrictions. There's usually more that needs to be done from a standpoint of a physician. Those are the times that we need to see patients. Other times that are as serious and also concerning is if they're noticing weakness. Typically that's an indicating of some ongoing nerve damage, and if they're unable to use their arm or if their foot is slapping when they walk, those are instances when they really need to see a doctor as soon as possible. My favorite thing to do when I'm not at work is spend time with my family. I have 5 children, 4 little girls and a little boy, and our recent addition to the family was just born about 3 weeks ago. So it's a lot of fun going home and seeing the kids. It's just instant chaos, and it really alleviates any of the stress you had during the day or any of the rigors you typically are involved with on a usual day at work. Lakeshore Bone and Joint is a very unique practice in the area of Northwest Indiana. We tend to have many subspecialized surgeons as well as physicians in the group that tend to cover the entire gamut of the care necessary to treat the complicated problems we often see in the office. We have physicians that will treat ailments of the spine as well as the foot and ankle, major joint surgery if necessary, hand surgeons, as well as pain psychology, pain management, rheumatology. There's a lot of these fields that tend to interact with one another as well as overlap with one another in treating the care of the patients that we see. I'm Nick Nanatovich, and I'd like to be your doctor.